So, shall I start by introducing myself? My name's Ed Beveridge. I'm a psychiatrist, so I'm a doctor specialising in mental health, and I work for CNWL. I'm based in Kensington and Chelsea, and I've got another interest which is in physical health in people with mental health problems. So this is a particular area of interest of mine. So I hope I'm able to answer your questions.
Okay. Hi, Ed. My name's Shaheed and I'm an NHS Ambassador, and I encourage people that suffer from Grenfell to seek help from the NHS. And today I'm here to ask you a few questions about coronavirus that the community wanted me to ask you.
No problem. I'll help if I can.
Okay, the first question I would ask is if someone was near the tower on the night of Grenfell fire and inhaled smoke, does that mean they will get coronavirus worse than others?
That's a really good question, Shaheed. I think it's I'm very conscious that it's a very difficult time at the moment because we're approaching the anniversary of the Grenfell fire, and a lot of people are going to be thinking very, very hard and having very difficult memories of that time, on top of the worry people might have around coronavirus. To answer that question, I suppose it's a hard one to answer because there will be a lot of variation between different people who were in the vicinity or in the tower during that night. And some of them will have inhaled smoke and got quite significant injuries from that. Some of them will have been affected less. And I was trying to do a bit of research around that to see if I could answer your question specifically. It certainly seems like if people are involved in a fire and they inhale a lot of smoke, then there can be long-term damage to people's lungs in a minority of people. And we know that COVID-19 affects the lungs. But then again, there's a lot of variation between people's, how likely people are to be affected by COVID-19 and get unwell with it for lots of other reasons as well. So, for example, we know that young people are less likely to be seriously affected than older people. People with lung conditions already there, like asthma, are more likely to be affected. So I suppose on balance, people who didn't have serious smoke inhalation and don't have other serious health conditions are probably at quite low risk of being worse affected by coronavirus than the general population. But I'd always encourage people, if they have any concerns, to get their physical health checked out, if they have any worries that they get COVID-19, and if they're worried about anything else around the time of the anniversary, because people are going to suffer with a lot more anxiety and other symptoms like that at the moment.
Okay, thank you. And the next question I have is, we're coming to the 3-year memorial of Grenfell fire, and loads of my friends are saying that they want to march for Grenfell and Black Lives Matter protests. What would you recommend so they keep safe?
Again, it's a really, really good question, and such a difficult time for many people because, as well as the 3-year anniversary, we've had terrible scenes from the US in the past couple of weeks. Some quite negative coverage in the media, I might say, about some of the protests that have been happening here and elsewhere, alongside the effects of the lockdown and worries about coronavirus too. So a lot of stress for people from the communities around Grenfell at the moment. The question is about safety around marching, and I suppose the first thing to say is that I would never advise people or tell people they shouldn't march or shouldn't protest. That's not for me to say, but I would also say that people should do as much as they can to keep themselves and the people they're with safe. And I think there are certain things that you can do in order to increase the chances of being safe in a public place. The main one that I would mention is what we call social distancing. So we are required to stay 2 meters apart from one another at all times. Not easy on a march or a protest, but it's also possible if it's well planned, and if people are patient and cooperative, then it should be possible to be able to stay 2 meters apart from one another. And I think that's one really important thing. The other things to mention are that we're increasingly, and we are going to be expected to cover our faces, to use face coverings. They'll be mandatory on public transport soon. So that involves something like a mask, not necessarily a medical mask. We're discouraged from using those because we need them for health and care workers. But there are lots of different kinds of face covering available, and there is some evidence that helps protect the people around you. So people should always keep their nose and mouth covered if they're in a public place, and especially when there are a lot of other people. Other thing is keeping your hands clean, washing them whenever you can, using hand sanitizer, avoiding unnecessary contact with people, avoiding touching your face, which I'm conscious that I keep wanting to do on this video, and I'm going to try and make sure I don't. So there are lots of things there that you can consider doing if you are thinking about a protest or a march, and I would encourage people to make sure that they do as much as they can to stay safe and keep the people they're with safe.
Okay, thanks for that great advice. The next question I have is, I heard losing smell and taste can be a sign of COVID. It's been 8 weeks and I have still haven't got my taste and smell back. Should I be worried?
Another really good question, and it's a hard one to answer as well. So we definitely know that losing your sense of taste and or your sense of smell are quite specific symptoms of COVID-19, and they're quite common. And we've known about that for a while, and now the UK government is officially saying that that's one of the key symptoms that is a sign that you might have it. Most people's symptoms go within 2 to 4 weeks, including the losing taste and smell. However, I was just doing a bit of research before coming on the call, and it does look like there's a minority of people who this goes on for longer. What we don't know is how long it can last for altogether, because we're only a few months into this pandemic. So we don't know a lot about how long some of these symptoms can go on for. So it may even be that there is a small minority of people who this symptom continues for a number of months for. We don't know yet. But certainly if someone continues to be worried about it and it's ongoing, they should continue to consult their doctor, their healthcare professional, to make sure that if there's anything else going on, that they get it checked out.
Okay, thank you. The next question is, I heard you can catch coronavirus twice, and if so, does it come back the milder the second time?
Good question. Again, difficult one slightly to answer, because because there is sort of varying information about whether you can catch this illness twice. What we know about this illness and other kinds of coronavirus is that we do develop antibodies to it, so our body does mount an immune response. And with other coronaviruses, that immune response can help you not catch it again. We don't know whether that's true with this coronavirus, but it may well be. So it's unclear at the moment whether if you catch it once, you can catch it twice, but it looks more likely that you probably would get some protection from having antibodies. Having said that, if you have had it, including a positive test, you should still continue to social distance as everyone else, because we don't know, and other people may be at risk of catching it who haven't had it already. With about the second part of the question, does it come back milder the second time around? Again, it's unclear. People are asking if the virus will itself change, and that people who get infected at a later stage might get a milder illness. But again, that's something for the future. We don't know. So I would say that the evidence suggests that it may be less likely that you'd catch it twice, but we can't rely on that. So we would still need to do all of the other measures that I already mentioned.
Okay, thank you. Next question is, how accurate is the antibody test? And how accurate is the antibody test? And I've had COVID symptoms, but I came negative in the antibody test.
So the antibody test is to show whether your body has mounted an immune response. So does it form antibodies, which are the particles that your body forms as an immune response to the virus. And we know that in many people, after 2 to 4 weeks, they will test positive for antibodies for the virus if they've had it. If you test positive for antibodies, it's very likely that you've had it. It's 95, 97% accurate as far as I'm aware. So if you've come up positive in the antibody test, it's very likely you've had it. If you come up negative in the antibody test, that does not mean you've not had it. It just means you haven't got antibodies or you haven't tested positive yet. So I'm afraid that even with a negative antibody test, it doesn't prove that you haven't had it, which is frustrating for people, because it's good to know. But if you come up positive, it's very likely you've had it. So at least that tells you something quite helpful.
Okay, thank you. It's been 3 months since I've had coronavirus, and will the antibody test be less accurate if I take it now?
So again, following on from what we were saying before about antibodies, we know that the antibodies don't form for a little while. So if you have it too soon, then you might be negative, even though you've actually had the illness. As far as we know, there's no reason why the antibody test would be any less accurate at 3 months, because if you've got it, then the test should detect it, no matter when it is in the process. Whether it lasts for longer than 3 months, it's a bit hard to say because we're very early on, but I would have said that at the 3-month point, I can't think of a good reason why the antibody test would be any less accurate. And in some ways, it's more reliable sometime after you've had the illness, so that your body has had a chance to create the antibodies that the test picks up.
Okay, thank you. Next question is, I heard ibuprofen can make coronavirus symptoms worse. Is that true?
Good question, and it sort of relates to a more general point as well about sort of things that we've heard in the media reported about coronavirus that are quite worrying for some people, because ibuprofen is a medicine that lots of people are quite reliant on for certain conditions, especially if they have painful conditions and so forth. And there was a story that was quite widely reported that there were suspicions that ibuprofen might make coronavirus worse. The more recent evidence that I'm aware of suggests that that's now been researched and is not thought to be true. So I think I can give some reassurance to people that it appears on the state of the science currently that ibuprofen is not unsafe to take in people who have coronavirus, although paracetamol is usually the thing that people take when they have COVID-19 symptoms. I would, of course, though, say that you need to be careful that you can take that there isn't any other reason that ibuprofen might pose a risk. Some people can't take it if you have asthma or if you have stomach problems, and some people with mental health issues on certain medications can't take ibuprofen either. So I suppose, provided it's safe for you to take normally, it doesn't seem to cause more of a problem for people who have coronavirus, and that's good news, because there was a big concern about that early on.
Yeah, okay. Thank you. And then last question I have today is, my chest is tight, I'm tired a lot, and I have shortness of breath. How can I tell if it's COVID-19 and not an anxiety attack?
That is a really good question, and it's a difficult one, but it's really important, because like we were saying earlier, today, this month, this time as we approach the 3-year anniversary, is a really anxiety-provoking time for people who have been affected by Grenfell. And we know that shortness of breath and other symptoms are very typical of anxiety. And if you've had a traumatic experience, then anxiety is a common after effect, especially when you're reminded. And an anniversary is, for example, a really important reminder for people. So it would not be at all surprising if people who are affected by Grenfell in some way became more anxious during this current week, especially with everything else that's happening at the moment. Chest tightness and being tired can be anxiety symptoms, but they can also be COVID-19 symptoms. So I think my advice to anyone would be, if you're not sure and if you're worried about your physical health, seek help. You can speak to NHS 111, or you can go to them online. You can contact your GP, you can talk to another health professional, but if you have any concerns about whether you have COVID-19, be that shortness of breath, cough, fever, losing your sense of taste or smell, get help with it straight away. Get a test if you need one, and then you can be reassured to some extent that as to whether or not that's the problem you've got. But with regard to anxiety, I think it's equally important that if you are suffering with anxiety and you have physical symptoms like shortness of breath and it doesn't appear to be COVID-19, that you also seek help for that. And there are lots of different ways you can do that. Again, you can approach your GP, but there's also the Grenfell Health and Wellbeing Service, who are available, especially around this time, to provide help with people's health, well-being, mental health in particular. So my advice would be, seek help, talk to a health professional about it, get some advice about what the best thing is to do if you develop any kinds of symptoms like this.
Okay, thank you, Ed. That's all the questions I have for today. Thank you.
You're welcome. You're welcome.